Well, as you may know, ESSEC is now opening a campus next year in Singapore with the ambition of offering multiple MSc programs. Of course, a general MSc program in management, but also multiple MSc programs in different areas. It just happens that we have already built quite a strong position in health in the region through our relationship with companies. And we can capitalize on this to offer this MSc program as a complement of the general provision of programs that ESSEC is going to offer.
Yeah, so what Gerhard says is more on the track record that Asia Pacific ESSEC campus has been built for the past 6 years. But we also sense there is a huge need from our corporate sponsors, from the industries we have been networking with. And there's another point I'd like to mention is that there is a huge transition going on in Asia, coming from triple transitions, namely epidemiological transition, demographic transition, and economic transition. And because of these three transitions, that the health issue becomes very paramount.
For the past 5 years, the ESSEC Institute for Health Economics and Management has been developing mainly executive programs, both from executives of the healthcare industry, pharma and medical devices, but also for public officials in the healthcare sector in the region. There's clearly a strong need, resented and expressed by the industry, of recruiting young executives who are well-trained and already have a good knowledge of the specificity of this industry. And as you know, actually, the Asia-Pac market is really the growing market and the future market for these industries. We hope to recruit young postgraduate students, either graduation from management, but also people from the life sciences courses, MDs, PharmDs, who want to work in the industry later on, and who through this program will gain time, certainly gain some, be able to boost their career, because they will not start from scratch when they start their career in this industry.
This program is particularly tailored for those young and talented executives, even already working in healthcare industries. And I think the major purpose of this program is to accelerate their learning curve and that to help them climb the promotional ladder faster and to equip them with the right knowledge and skill in this particular industry.
We want to provide our students with the new skills that industry needs today, considering their transformation and, of course, considering also the challenge of meeting the needs in the Asia-Pac region. The main challenges are market access. When I talk about market access, it's really discussing with public authorities, local payers, to guarantee access to new drugs and to new medical devices in the region. Certainly also business development skills are important. Companies are looking for partnerships, are looking for new opportunities of working with local startups to develop new products. And there's also a full range of new jobs around new services offered both to healthcare providers and to patients around drugs. Companies now really realize that they have to offer something else than just a product, and that they need to accompany or to support their products with services. Services on health education, health promotion, but also on health services organization, patient management patterns, etc., etc. And considering the experience we have gained in these areas on other markets, European markets, but also on more developed markets, we think that we can really bring value added to the students for these new skills.
We have done a very meticulous gap analysis in terms of the program provided in this part of the world. We find there is none adequate, suitable programs, Master of Science programs for for healthcare industries in particular?
First, we have observed that the program we're offering is unique in the region. There are other programs around the management of healthcare services, but no one specifically dedicated to management careers in the healthcare industry. So basically, students will not have any choice if they want to join the healthcare industry.